Welcome to the Introverted Doctor podcast, dedicated to uncovering myths, mistakes, and misconceptions that hold healthcare professionals back from having better interpersonal relationships with their patients and colleagues. In each episode, we focus on different aspects of a doctor's professional life, such as communication techniques, mindset, routines, habits, and behaviors, with the goal to show how to eliminate anxiety, trip-ups, and unwelcomed results that come from ineffective communications. I'll reveal research routines and will have guests in future podcasts that will help shine light on a particular topic. At the end of this podcast, I'll summarize the key tips so that you can apply them right away to start living a fuller life at work, home, and play. I'm your host, Dr. Lalit Chawla, and in this part we're going to talk about part 2 of the 3-part quick series on frameworks, communicating more effectively with your patient in a high-stress environment. In the first episode, we talked about the introduction, setting the stage so that after we've introduced ourselves, broken the ice, both the patient and ourselves are more comfortable. That was the first episode. In this episode, we'll deal with the middle of the interview and how to start the deeper conversation or issues that the patient will bring up. The show notes can also be found at the introverteddoctor.com website. And let's get to it. I'm going to tell you a true story of something that would have scared me terribly when I first graduated and became a full-time doctor and started, it just totally would have scared me. And the truth is, even this situation when it happened, as a veteran physician, kind of caught me off guard a bit. A nurse came to me and said, "Dr. Chawla, this patient came in and has been crying so badly and wants to see you." I asked the nurse, how come she's crying? What happened? The nurse said, "I don't know, but she just keeps crying and wants to talk to you, and she won't tell me what's going on, and she won't leave. So I put her in the exam room. I hope you don't mind. She's in exam room A." And with that, the nurse left, and so then I went to the closed exam room door, and as I was outside the exam room door, waiting to open the door, I could hear Kelly sobbing loudly and uncontrollably. So upon entering, when I saw the tears flowing, the first question that came to my mind was, what happened in her life to cause this severe reaction? After I introduced myself to her and she finally stopped crying, I asked her, what's been happening for you to be so upset? And with that question, the clinical conversation began. And with several follow-up questions, her story unfolded. And then I began to understand what was happening in her world. Those few simple sentences I asked her were simply good quality questions. Those good questions were what I had developed over the years of trial and error and from so many successful and unsuccessful dialogues. Questions, particularly good questions, at the right time is the key to opening the clinical conversation door, especially when it comes to social and personal issues where there are so many people involved and so much information to gather and so often a lot of variables. In the past, the questions I may have asked as an inexperienced physician would have been slow and ineffective. But over time, I learned how to ask more effective questions. And if there's one thing I've learned over the years of practicing medicine, is that the quality of the answers really depends on the quality of questions I was asking. Now, why are questions so important? The reality is that questions are the cornerstone of discovering everything we do in terms of human history and discovery, from the realm of innovative ideas and designs to uncovering what's happening in a person's world, including our own. In fact, The whole premise of science is based on a hypothesis, which essentially is a question. On any given day, clinicians spend 40% of their time asking questions. This vital skill allows the questioner to uncover what's happening with a person's health and life situation. The better questions we ask as clinicians, the better understanding we have of our patient's situation. In medicine, as you already know, it's called getting a history from the patient. Perhaps that's how the term was coined. His story or her story. Kind of a play on words. A good clinical history removes ambiguity and gives the healthcare practitioner knowledge and clarity. After the clinician gets the history, he or she often carries out a physical exam and orders tests to narrow down the many possible diagnoses from the differential diagnosis to a very specific diagnosis. And learning the skill of asking good questions to elicit a good history is not as difficult as people think it is. It's a very learnable skill and a skill that can be fine-tuned. You don't need to do what I did, learn the hard way and take years to learn this. I'll share with you some great clinical questions that are effective in a clinical setting. Now, in terms of this patient that I mentioned earlier, I needed to get a clearer sense of what was happening in her world and who were the key players in it. That's why asking good questions were important in terms of providing clarity in her situation and understanding her needs. In her specific situation, her husband and her were arguing for several months. And note, this was not this was not a bad marriage. They had never really argued to this extent. He wasn't cheating on her or anything like that. But things had slowly been escalating. They were still talking. But now what brought Kelly in was that for the last 3 days, he hadn't come home to even see the kids, who he was very close with. He made breakfast for them every morning. He had now even stopped texting her and calling her. So in this situation, or any similar situation, it was important to ask good questions and more of an open-ended question. And so some good examples of a good open-ended question, which I asked to her, was, how would you describe your relationship? What changed happened? When did you notice the change? What do you think caused the change? Who else was involved? What do you think may have caused this? To get insight into her and her husband's psychology, or in other words, their life story, it was helpful for me to ask questions such as, what was your childhood like? What was your husband's childhood like? What was your father and mother like? What were his parents like? These types of questions helped create a clearer picture to see who were or are the key people involved and influencing that person's behavior or decisions. This expansion helps create understanding from many relevant perspectives, which increases the options and areas of influence. So we were together able to understand her role in the conflict, and we were able to better understand his role in the conflict and come up with better empowering solutions. And by the way, one key mistake that most doctors make is that once they ask a question, within 7 seconds, they interrupt the patient. So no wonder the number one complaint patients have about their doctor is that they don't feel they've been listened to. As patients, we feel we've been listened to when the doctor has taken the time to ask questions to learn more about our particular symptom or situation. When the doctor doesn't ask questions, we as patients feel unsatisfied, as though the interaction is incomplete. Patients have complained to me that when they've seen another doctor who briefly examined them For example, they had a rash and then instantly wrote out a medication without asking any questions about that rash. In such cases like that, the diagnosis may have been correct, but the interaction felt totally empty for those patients. It was very mechanical, robotic, and the whole experience and treatment felt incomplete. And it certainly doesn't bode well for the profession. Have you ever had a doctor ask you little or not enough questions before giving you a treatment plan? It's not a very reassuring experience. And I can tell you that from myself and also having family members when I've been with them to doctor's visits. Okay, so now, one of the things patients, they usually come in with particular statements such as, "Doctor, I have a pain in my chest. My eye is red. I feel weak. I feel dizzy. I'm having difficulty in my life. I feel stressed, anxious, etc." All clinicians hear these common statements on a daily basis. What inevitably follows is a question from the physician, either open-ended, those with answers that require more thought and elaboration by the patient, or closed-ended questions, which are really yes or no responses. And a common question I get asked from medical learners is, when should I use these type of questions to be more effective? So an open-ended question generally is a great way to start the middle of the conversation or medical issue at hand. And the general rule for open-ended questions is that they start with what or how. And those questions generally look like this. What brings you in today? What do you mean when you say you feel anxious or frustrated? What do you understand about the illness? What treatment modalities have you tried? What did you hope to accomplish with this clinical visit? What is your biggest concern? What is taking most of your attention? How do you feel? How would you describe your pain? How were you expecting me to help you today? Can you tell me more about the situation? Does the pain radiate anywhere? Did your symptoms give you any ideas of what illness you might have or think you might have? And what are you hoping to achieve today? Closed-ended questions are short and generally have a one-word answer, yes or no. And they're usually designed to find specific information. When we in our own mind are trying to rule in or out a possible diagnosis. So, for example, if you're trying to elicit if a person's chest pain is cardiac in nature, you want to know, do you have chest pain? Yes or no? Does it radiate to your jaw, arm, or back? Is it severe? Is it dull? Is it a sharp pain? Is it constant? Does exercise or climbing stairs make it worse? Do you wake up with pain? So other examples of closed-ended questions could be not related to chest pain as the previous example, but just in general. Do you have a headache? Do you take your medications daily? Do you ever miss more than one dose? Are you having trouble sleeping? Or are you having trouble seeing things close up versus far away? Do you have any support, like friends or family, that can help you? Did I answer all your questions? Did I understand you correctly when you said ... Did we deal with all the core issues today? Closed-ended questions help create a greater sense of focus and helps you support what you may be thinking in terms of ruling in or ruling out a diagnosis. So the general rule is that after I've introduced myself and we've had a little small talk, you can see the last podcast for more detail on that if you're interested. I'll ask an open-ended question. Only afterwards I'll resort to more closed-ended questions to zero in on specifics. Questions are not only a vehicle to get useful clinical information, but they're also helpful in reshaping and redefining situations so that we can come up with more empowering answers. I'd like to share with you another real case about how questions can be used to reframe the way people experience a tragic event. I've changed the names to protect patient confidentiality. Tanya's 34-year-old son, Brian, was severely injured in a car accident and was admitted to the intensive care unit. Understandably, she was worried as she was consumed with questions like, will he recover completely? Is the brain injury permanent? Will he be able to work again? Will he be able to pay for his treatments? Is his wife going to leave him? She couldn't stop asking these types of questions that had no immediate answers. She approached the doctors and other healthcare staff looking for definitive answers. But given the severity of her son's injuries, they couldn't provide any concrete answers. Understandably, she was stressed. One of the most challenging parts in any situation like hers is waiting for the results of a test and waiting for the effects of the treatments to kick in. Have you ever had to wait to find the results of an important test to see whether it's cancerous or not, or wait to get surgery? I can tell you, having lost both my parents to cancer and waiting for results like that, time can move incredibly slow. And there's nothing more anxious, in my experience, in those times. So Tanya booked this appointment with me because she was anxious, sleepless, and distraught. She told me what happened to Brian and how she was not coping well. She told me Brian was able to talk to her and was slowly eating, but he was nowhere close to being back to his normal self. I asked Tanya one simple question. If you looked hard enough, what possible good can you see that may have come from this situation? And for you, or whether it's for him, what good could have come out of this if you looked really hard? Alternatively, I could have asked her, how would you advise someone else if they were in a similar situation to help them see if there were any benefits to what had happened? Sometimes removing a person from a scenario allows a person to look things from a distance, which allows them to reframe and come up with better answers and to the situation. So now I already had extremely good rapport with Tanya, so this question was something I felt I could ask her. And with great courage, Tanya said, well, I've had more quality time with him than I've ever had. I've come to understand that what really the value of life is all about. Brian's also looking at his own life differently and realizing how short life is. He also realized that he was not spending as much time with his wife and kids, and maybe it was part of his lack of presence that was contributing to their failing marriage. Now, this was an incredibly thoughtful response by Tanya, which showed great insight. It didn't change what was happening in her world, but it did change how she viewed what was happening in her world. Just by asking and answering this question, she was able to see a different and more empowering perspective, which gave her a greater sense of control over the circumstances. She subsequently used the same question to help her son reframe the challenging situation he was in. Essentially, one better question created a shift in her perspective. I also ended up discussing with her about the 6 human needs, and that created a greater self-awareness of how she was viewing her situation. She knew she needed to have a high level of certainty and control in her life, and she valued love and connection she had with her son. But by challenging her, she was able to ask herself a different question. How can I bring the love and joy today to create the better the best possible day to day, because in the reality was that we only have one day and we live one day at a time. So she was able to move to this place of feeling hopeful and helpful rather than feeling helpless. And from being really a victim of her circumstances and looking at possibilities, and it really changed her outlook. So from asking disempowering and unanswerable questions such as, why did this happen to me? And moving to a more solution-focused question such as, what or how can I learn from this situation? And how can I help him recover? Tanya was able to increase her degree of certainty. So moving from why or if questions, which generally are critical, judgmental, and rarely reveal an answer, and moving towards a what or how type of question allows the person to come up with greater possibilities. If you ask better questions, you will find better answers. Happier and successful people ask more of these empowering types of questions. This ability to ask good questions also extends beyond outside the medical arena and into other professions, and especially into our personal lives, and it can help create meaningful change. Happier and successful people ask more of these empowering type questions. This ability to ask good questions also extends outside of the medical arena and into our professional life. And it allows us to change and create greater meaningful change, whether it's with our children, our spouses, and how we, in our recreational life as well. Well, that's really the core of what I wanted to share with you. Questions and establishing the dialogue with the patient is critical in the middle aspect of the interview or interaction. The next podcast of this little mini-series deals with how do we effectively close or wrap up the interaction or clinical visit. This was a big episode. Here are a summary of the key points. The fact is that questions are a key component of every clinical interaction. Asking great questions helps clarify how we can help patients by demonstrating we care enough to ask good questions. It demonstrates we want to know the situation correctly and completely as possible. Start the interview with open-ended questions, which is generally starts with what and how. Be patient and listen to the patient. It's hard when there's a time crunch, and always remember that being efficient and trying to be fast is not always efficient at all. Fast is slow, and slow is fast. The third thing, use closed-ended questions to narrow in on specific information. For sensitive questions such as taking a sexual history or street drug information or code status, use the phrase this is the phrase I use. The next question or questions are standard questions I ask everybody. It's just general procedure. Do you mind if I ask them? It just helps prevent the feeling that you're judging them. You think they're you're using street drugs, or whether they're sexually promiscuous, etc. You just take that whole judgment out when you ask that type of question, or you preface it that way. Be cautious when using why or if questions. They can leave you and the patient stuck. If you're trying to find some reason they might be doing something, ask them, do you have any thoughts as to the choices you made? And that's it. I hope this podcast served you in some way, or at least served as a reminder. Now, you don't need to use all of these strategies, but pick one or two and see if it helps you become better. If you've enjoyed listening to this podcast, please share this with a friend or colleague and subscribe to us in iTunes, YouTube, Spotify or Google Podcasts or your favorite podcast app. And please don't forget to leave a rating. I know it's a small thing, but it really makes a difference in terms of helping others find this podcast. I'm Dr. Lalit Chawla, and thank you so much for listening. Let's together make a greater and more effective community and inspire people to be their best. Thank you so much, and on the next episode, I'll be sharing with you how to conclude the interview. This is the one area so many forget. I slip up on this more often than I care to admit. Have a great day and a great week.